ice pack, I usually start with that straight away and throw that in the freezer. That way it's already frozen by the time you get to it. Artificials, or you guys typically don't use this because they already have the preferred tools that they like. But this, we do want to use. So you want to grab this guy and these. Your solution is in here, so that's where they're going to drop the biopsy. It's always the yellow ones, only the yellow ones. The Zamboni fluid, only those. The other two, you don't, the saline, you don't really need, only those. It also comes with the consent form. So you want to make sure they fill it out, scan it and such, and it's always going to be in the box, so you don't have to remember it. It's always in the box. Okay. I pull this out, Zamboni, and then kind of lay it out. So first they numb up the area. So you want to have a measuring tool, so they measure the side where they're going to do the actual injection. It's usually a plain injection. I set that up first, and typically you're in the room with them because it all happens at once. There's not like a break in between. So you set that up, and then these are the tools that they typically use for that. The scissor you also need, because they're gonna, once they clip it, they have to drop it in here. So you want to have this, like, as soon as they get this part started, you want to have this ready. And then the UPS bag, this whole box goes inside there. I put everything, like even this guy, because it just keeps it as cool as possible. Because it's being shipped, it needs to stay cold the entire time. It's overnight ship, but we want to keep it cold as much as we can. And then the form is pretty normal. You want to circle the laterality of the leg that they're going to use, left or right. I normally ask the patient which one they use. Sometimes they don't have a preference, but I always ask. Usually it's the left, because that's most people are just comfortable with that side. But you just want to make sure you circle the correct one, date it correctly, time it correctly, and check one of these boxes. You want to make sure you check one or two. Normally it's number one, but you just want to make sure you check it. That's pretty much it.